Good morning, everyone. This is 10 a.m. sharp, Indian Standard Time. The reason I'm saying Indian Standard Time today because the esteemed speaker of the day, Dr. Priyaranjan Jha, has joined us all the way from United States of America, uh, and is here with us. And I'm really happy that today, this morning, we are going to discuss a very, very important topic in this year edition, a webinar series for knowledge cross-selling. And the topic for the day is coronavirus and Indian economy, which would be delivered by the esteemed speaker of the day, Dr. Priyaranjan Jha, Professor of Department of Economics, University of California, Irvine. So just to give you a brief idea that how this webinar is going to happen, I'll open this session with your small brief introduction, which would be followed by your speech for say 40 to 45 minutes. And after you deliver your address, we are going to have questions and answers. So I'll get the text questions, I'll collect the text questions from all the participants, and then one after the other, I will ask those questions to you. Just a request to you would be, because generally the experience is there are many questions. So I generally always fail to complete all the questions those I'm asked. So I would request you to give a brief answer so that I can take many questions. And it's now time, and I take the privilege to introduce Professor Dr. Priyaranjan Jha to everyone in the audience. Professor Dr. Priyaranjan Jha is a professor of economics at University of California, Irvine. He did a BA in economics from St. Stephen's College, Delhi, and MA in economics from Delhi School of Economics, and a PhD in economics from Columbia University. His areas of research are international trade and economic growth and development. He has published a large number of papers in peer-reviewed journals such as Economic Journal, the Journal of International Economics, the Journal of Development Economics, the European Economic Review, the Journal of Applied Economics, and the World Economy. He has also served on the bodies of editors of several journals. Currently, he serves as a co-editor of the Indian Growth and Development Review and an associate editor of the Journal of Development Economics. He also writes in popular media outlets such as the Economic Times and the Indian Express. We are really honored and privileged to have you here today, sir. Thank you very much for kindly accepting our request and being here. Over to you, sir.
Okay, you're welcome. Thanks for the charitable introduction. And let me try to share my screen now. Okay. So let's see, share here. Okay, so can you guys see my screen?
No, sir, we can see your pointer, but the screen is blank.
Oh, the screen is blank. Okay. You are, what does it say? You are sharing start. Let's see. Share.
I think you can click on stop sharing again, and when again you click on share, it will ask you, please take the first option, the entire screen.
Okay, so you still cannot
now
see,
it's visible. Now it's visible, sir. Now we can see it.
Now you can see it. Okay, so let me try to minimize this. Yeah. Okay, I think I am ready now. Let me put it in slideshow mode. Okay. So everything looks good. Let's start. Okay, so thanks, Gautam, for the charitable introduction. It's a pleasure to talk to all of you, and hopefully you will learn something new, at least something. I mean, all of you have been reading and hearing a lot about coronavirus and the economy, and I hope that after attending this talk, you will have learned at least one new thing. We'll see. And Gautam said that I'm going to speak for 45 minutes. I think I'll speak for lesser time than that, maybe 25, 30 minutes. We'll see. I have just prepared a few slides and we'll see how much time it takes. And then I'll open it to questions. Okay. So everyone can hear me clearly, right?
Absolutely. So you're loud and clear.
Perfect. Okay, so here is some background. So the key question that I'm going to discuss today is, are the mitigation efforts, and by mitigation efforts, I mean population level social distancing by restricting economic activity and the mobility of people, whether that is worth the economic cost. So are the mitigation efforts undertaken to slow the spread of COVID-19 worth the economic cost? Okay, so that's also being framed as lives versus livelihood kind of debate in India and many other countries. Everywhere people are grappling with this big question. So this question is being asked in all countries, particularly so in developing countries, as the economic costs of mitigation efforts are becoming apparent, and they're turning out to be substantial. So China just reported a 6.8% decline in GDP in the first quarter of 2020. And this is the first time that China has experienced a decline in GDP in 40 years or so, over 40 years. And if you look at the US, the US economy is losing jobs at an unprecedented rate, never seen since the Great Depression in the 1930s and so on, with the number of unemployed standing at a staggering 26 million as of this Thursday. And they released the unemployment report on the first Friday of the month. So next Friday, the unemployment report for April will come out, and the unemployment rate is expected to hit double digits. So within a month, unemployment rate could go up from 4% to 10%, even though it took a long time, maybe a year and a half during the last financial crisis for the unemployment rate to go up to 10%. But here it could happen in a month, and then next month, who knows, it could be 20%. People are saying it could go up to 30%, which is really scary. Coming to India, in the Indian context, people are expecting Indian economy to experience a significant slowdown in output growth, if not an absolute decline. I think absolute decline is a distinct possibility now, given the lockdown and so on for the year 2020. So the question is, how do these economic costs stack up against the benefits of the mitigation efforts? So what is the benefit of mitigation? Mitigation here.
इंटरनेट का इश्यू है कुछ?
Excuse me, sir. Just a minute. I request everyone to please keep their cameras mute. I request everyone to please keep their microphones mute. Thank you. Sir, I'm even unable to control it from my side for some reason. Generally, I keep everybody on mute mode.
You cannot mute everyone?
Yeah, I cannot. I don't know why. Technological hurdles, maybe.
Okay,
please.
Yeah, so talking about the benefits of mitigation, and in the Indian context, you can think of mitigation as the lockdown for now. So what are the main benefits of mitigation? Benefits come from
mic और ये वीडियो दोनों.
I'm really sorry, sir. Give me a minute. I'll find out.
ऐसे पता है, वही तो मैं connected ही नहीं हूँ उसमें.
Just a second, sir.
यही मैं उसमें से निकल चुकी.
Ma'am, can you hear me? I'm sorry, but please keep your microphone on mute. Please.
कुछ problem हो गया. गिरीश सर का ही phone आ रहा है.
Maybe even she is not able to hear me. I don't even see any unmute in the participant list. This is surprising. I don't see a single person on unmute. Yeah.
There is one Dr. Srishti who is on.
Pallavi Gedamkar, founder. Yeah, muted. Please go ahead, sir. Sorry for interruption. I have muted.
The of mitigation is the lives. You are going to save some lives by putting the economy under lockdown and restricting the mobility of people. So how many lives are going to be saved? Now that is a very difficult question to answer. So rather than guessing, I'm going to do some back of the envelope calculation using some numbers from a very influential study by Imperial College London. The lead author is Neil Ferguson. And so he's done these calculations, he and his team, they've done calculations for all countries in the world. And for India, we've come up with a number that lockdowns could potentially save 2 million lives, which would be like 20 lakh people, compared to the case without any mitigation efforts. So if India does not engage in any kind of social distancing, enhanced social distancing, 55 lakh people could die, but with social distancing, that number can be reduced to 35 lakh. So the number could go down by 2 million. So I'm going to show you some calculations based on this 2 million number. Now, this 2 million number is based on certain assumptions about the basic reproduction rate or not. That is, how many people an infected person is going to infect in turn. So the average number of secondary infections that a single infected person causes, and also how restrictive the social distancing measures are. So they also have a calculation where in addition to general social distancing, you also have strict social distancing of the elderly, older people, because they are at a greater risk of dying from COVID. And so if you can isolate them and separate them, that is going to reduce the number of deaths as well. But this 2 million thing is just for regular social distancing of the population, not any separate isolation of the elderly. And the R naught for this calculation is of 2.4. That is, an average person infects 2.4 people in turn. Okay, so based on that, the number is that India could save 2 million lives by October 31st or something. So from March to October, about 2 million lives can be saved through lockdowns and things of that sort, enhanced social distancing. So we have 2 million lives. Now, our economic cost is going to be in terms of unemployment and GDP, a slowdown, and so on. So how do we translate the 2 million lives saved into a number that can be compared to economic cost? So this is something that I'm going to talk about in a second. But this picture tells you how social distancing saves lives. Okay, so how does it save lives of people? If you look at the picture on the left, so this is this red curve here, red bell-shaped curve, is the number of new daily cases. If you do not practice any mitigation, then the virus is going to expand through the population, and the daily number of cases is going to increase exponentially till it hits a peak, and then it starts coming down. Okay, so these are the number of cases, and if you know integration, you know the area under this curve is going to be the total number of cases. Okay, now how many of these are going to be serious cases which will require hospitalization? Only a fraction of total number of infected people require hospitalization. So the dashed red line, or the dashed red curve, bell-shaped curve, that gives you the number of people who will require hospitalization every day. And the solid black line here, that gives you the total hospital capacity, hospital beds that a country has. Okay. And when the number of people needing hospitalization exceeds the number of hospital beds, then people start dying for lack of care. And that's when a lot of deaths come about. Okay, so this orange area here between the dotted or dashed bell curve and the solid black line, that gives you the excess number of people who need hospital care compared to your beds. And since you do not have enough hospital facilities, there's going to be death. So that's where the death comes from. Okay, this orange area. Now, if you do mitigation, you're going to flatten the curve, something that all of you must have heard about, read about. And flattening the curve means this red curve now becomes flatter, and so the number of people infected does not really change. The area under the curve is not going to change, So the curve is much flatter. So this is going to happen over a much longer period of time. And when the same number of people get infected over a much longer period of time, what happens is that the number of people who need hospitalization also grows slowly. And so you flatten not only the solid red curve, which becomes solid blue curve, but the dashed red curve also becomes flatter, and it becomes the dashed blue curve here. And now this dashed blue curve is below the solid black curve, which was the number of hospital beds. And so if the dashed blue curve is below the solid black curve, then you never get into a situation where you do not have hospital beds for sick people. And this is how you reduce deaths by social distancing, by lockdowns, and so on. So you're spreading the number of cases over a longer period of time. As a result, at any point of time, you don't have a surge in serious cases, people who need hospitalization, so that your hospital capacity is adequate, is able to handle all the serious patients. Okay, and so if you can handle all the serious patients, number of deaths is going to be pretty low. So this is how social distancing or lockdown saves lives. Now let's talk about how to translate the lives saved into a monetary figure. So how to calculate the economic benefits of lives saved. How does one evaluate the economic benefits of 2 million lives saved? For obvious reasons, people are reluctant to put a monetary value on human life. This is something that people are not comfortable with in general. However, if you're a policymaker tasked with adjudicating what is best for society, you must engage in a cost benefit analysis. So if you are having a debate about lives versus livelihood, then you have to come up with a number for the economic benefits of life saved versus the cost that is going to come from reducing the livelihood of people, at least temporarily. So how do we do this? One way to do this is to use this approach called value of a statistical life. So this is a common approach for evaluating lives in a lot of policy contexts. It's used a lot in the US in the context of environmental policy. So you want to adopt a regulation which will reduce the emission of, say, nitrogen oxide or sulfur dioxide or any of the chemicals that are emitted by industries. So you want a regulation which will reduce the emission of these chemicals. Now that is going to reduce the incidence of lung disease and so on, and fewer people are going to die of respiratory disease and so on. So, however, these regulations are going to be costly. They are going to make it costly to produce a lot of goods, and there's going to be less production of a lot of goods which emit these pollutants into the air. And so how do you do the cost benefit analysis? So you calculate the value of lives saved through reduction in respiratory diseases using this concept called value of a statistical life. So what is this thing called value of a statistical life? Basically, it is computed based on how much money people are willing to pay to lower the probability of death. Okay, so for example, if you are willing to give up $1,000 to reduce the probability of death by 1%, then the value of a statistical life is $1,000 over 0.01, which is $100,000. Okay, so this tells you that effectively that you will pay $100,000 to avoid dying tomorrow or dying from COVID or something like that. Okay, so this is the way people calculate value of a statistical life. And in a recent paper to University of Chicago economists, Michael Greenstone and Vishaan Nigam, they have used this concept of VSL to quantify the economic benefits of the lives saved in the US resulting from the mitigation of COVID-19. And for the US, they have used an average value of 11.5 million per life saved. And so this is based on a lot of studies about how much people are willing to pay to reduce the probability of death. So based on that, they've used a value of $11.5 million per life saved. Mind you, this is not how much a typical person would earn in the US. Okay, so even though the US is a rich country, an average person does not earn $11.5 million over their lifetime. I'm not going to earn $11.5 million over my lifetime in the US. This is a different concept. It's about how much people are willing to pay to avoid reduce the probability of death or avoid death in general. So how do we come up with a number for India? Ideally, you would get it from Indian sources. Do survey how much people are willing to pay on average to reduce the probability of death. There are no such surveys for India. So I'm doing some back of the envelope calculation using the US number. So I'm going to adjust the US number to make it relevant for India. And how do I adjust it? So I do a simple rule of thumb kind of thing. The US per capita income in 2019 was roughly 30 times that in India. And so I'm going to use 1/30th of the VSL in the US as the VSL for India. Okay, so that gives me a figure of $0.38 million, which is $380,000. And that at the exchange rate of about 70 rupees to a dollar, it's 2.85 crore. At current exchange rate, 75 rupees, maybe it will be slightly less, maybe it will be 2.75 crore. So this is a huge number. Again, you can see that this is not what an average person would earn in their lifetime. Okay, so it's a lot more. So VSL is a slightly different concept, as I mentioned earlier. Now, how do I calculate the benefits of 2 million lives saved? I just multiply it by this number. And so I get $760 billion. So that's the benefit for India, if you believe these numbers of 2 million lives saved. Okay. So one way to think about the economic benefits of mitigation would be to say that 2 million lives saved is worth $760 billion. And now let's compare this against the cost of mitigation efforts. And you can see if you change any of the numbers, this is going to change. So if instead of saving 2 million lives, the mitigation efforts are going to save only 1 million lives, then the benefit becomes $380 billion. Okay, if they just save 100,000 lives, 1 lakh lives, then the benefit becomes $38 billion. Okay, instead of 380, it becomes $38 billion, and so on. So the number is sensitive to the assumptions made, but it gives you a rough idea. Okay, so if we believe that 2 million lives are going to be saved, and if we believe in this VSL approach and think that the Indian VSL is kind of proportional to the US VSL related to the relative differences in standard of living, then you come up with this number. Okay. Now, some caveats, some of these things I've already mentioned. If the number of lives saved is less than 2 million, then the benefit is going to be reduced. If you use a smaller value of VSL, then again, the benefits will be reduced. And also, I've used an average value of VSL and treated all lives saved as one. However, there are good reasons to think in terms of quality adjusted life years. And what this means is that when you're thinking about how many lives you're saving, you should think more about how many years of lives you're saving. So if you're saving the life of an 80-year-old person who may have just 5 years more to live, then you've just saved 5 years of life. And compare that to saving the life of a 30-year-old person. There you've saved maybe 50 years or 55 years. And so you have to put more value on the life saved of a younger person than an older person. And so if you make those adjustments, again, the numbers would be different. And in general, since old people are more likely to die from COVID-19, it would be a good idea to do these calculations in terms of adjusted life years, quality adjusted life years, rather than simply multiplying 2 million by some average value. But those are for sophisticated calculations. So if a policymaker tasks me with doing this calculation, I would do a much more sophisticated analysis. But this is just a back of the envelope kind of calculation. Okay. Now, in addition to the direct benefits from reducing COVID-19 deaths, you have some auxiliary benefits of lockdown, something worth mentioning as well. So there's going to be reductions in death from road accidents. And I have a friend who is a very senior police officer in Maharashtra. And I asked him if there are any data on road accidents. So he immediately sent me some data for Maharashtra for March. So I compared the road deaths in 2019 March versus 2020 March. And I found that there was a 20% reduction in road deaths in Maharashtra in 2020 March compared to 2019 March. And he told me that Maharashtra government imposed a lockdown from the 20th of March. So just for a 11-day lockdown, just because of the 11-day lockdown in March in Maharashtra, there was a 20% reduction in road deaths. So if you aggregate it for the whole of India, there's going to be substantial reduction in road deaths. Okay. There's also going to be reduction in crime. If there are fewer people outside engaging in economic activity or anything, there's going to be reduction in crime as well. Then there's going to be reduction in pollution as well. There are these anecdotal evidence of reduction in pollution. So pictures of the Dhauladhar mountain range clearly seen from 250 kilometers away in Jalandhar has gone viral on the internet. So older people are saying that they had not seen Dhauladhar mountain from Jalandhar in 30 years or something. And similarly, pictures of India Gate in Delhi, which is usually shrouded in smog or something at this time of the year. Now you see beautiful picture of India Gate and so on. And there are some estimates I was reading somewhere that people have measured pollution as well, nitrogen oxide and so on. And there's evidence of reduction in those things. So these are also going to reduce deaths. They're going to reduce respiratory illnesses, and so there's going to be reduction in death. So these things should also be added to the benefits from reduction in COVID death that we talked about earlier. Okay, so these are all the benefits from lockdown or social distancing. Now let's talk about the costs. The bulk of the economic cost comes from a reduction in GDP and increase in unemployment. Now, before COVID-19 struck, the IMF expected India's GDP in 2020 to grow by $267 billion. If the lockdown reduces GDP growth to zero in 2020, then the short-run economic cost of saving 2 million lives would be $267 billion. Okay. However, I should add here that even if the government was not going to undertake any mitigation efforts, still there would be a slowdown in GDP. So the entire loss in GDP growth is not going to be due to the lockdown. In the absence of a lockdown, also there would be at least a slowdown in GDP because a lot of people are going to die as well. So there's going to be a lot of disruption of economic activity, even if no mitigation efforts are undertaken. Okay. I mentioned here that people are going to get sick, die, and you know that there's going to be slowdown in economic activity no matter what. Even if the government did not impose a lockdown, people would be scared, and so they won't go out as much, and definitely they would cancel their plans to visit tourist places and so on, go on vacation. All those things would happen even in the absence of a government mandated lockdown. Now, so this is based on the IMF estimate, 267 billion. But there are some estimates I was seeing in the Indian media that the Indian economy is expected to lose over $4.5 billion every day during the first 21 days of lockdown. So if you say that the lockdown is going to last for 2 months, then this would give you 60 times 4.5. So this is like $270 billion or something. So that would be a lot of money. Okay. So I'm not going to give you a conclusion about benefits, whether benefits will exceed the cost. I'm just going to tell you how to think about these things. Okay. So if a policymaker tasks me with it, then I'll do a more serious calculation and maybe come up with a number. But otherwise, I'm just telling you how to think about benefits and costs of a lockdown or social distancing. Okay, so this is if there was a GDP slow down for just 1 year. But if GDP growth is slower for several years, then the cost could be much higher. So economists say that the total cost depends on whether the recovery from any kind of recession is V-shaped or L-shaped. I won't go into the details, but V-shaped means basically you come down and then quickly go back up. So if you were expected to grow at 5% before COVID, and you suddenly have a loss of say $100 billion in GDP in 2020, in 2021, you recoup that $100 billion and then start growing at 5% a year. That is a V-shaped recovery. L-shaped recovery, on the other hand, is if you lost $100 billion in 2020, in 2021, you're not going to make up that lost output, but you will start growing at 5%. So the 100 billion that you lost is gone, and you start growing at 5%, but now you're growing at from a slower base. So there is a much larger loss in both cases, but the loss is less in the V-shaped recovery than in the L-shaped recovery. And in the US case, Tim Cook was mentioning the other day that he is expecting there to be a V-shaped recovery, so the losses could be less. So the losses could be concentrated in the short run rather than in the long run. Now there's going to be an increase in unemployment. Wait, what happened? I jumped several slides. No, oops. Sorry, let me go back to where I was. Yeah, so there's going to be increase in unemployment, which also has long-term consequences for the unemployed, and hence the economic cost is going to be high. That is from reduced lifetime earnings. So whenever someone gets unemployed for some period of time, their lifetime earnings goes down. It's not just earnings going down during the period of unemployment. Also, actually, people who are going to enter the job market at a bad time, they have lower income throughout their life. So that is a bad news for people who are going to enter the job market right now. They'll have a hard time finding jobs. And long-term and unemployment also leads to lower life expectancy. So that's another cost. Okay, so these are some of the costs. Let's look at some other costs. Now, in the context of India, we've some additional problems, that a large number of workers are informal workers. So in this chart, you look at number of percentage of workers who work in the informal economy for different countries. And when you look at India, you see that it's more than 75%. So more than 75% of the workers in India are in the informal sector, and that makes it difficult to deliver aid to them because government does not have a record for them. They don't pay taxes. So making transfers to them is very difficult. So that is an extra challenge, and that makes providing aid very costly. So this is going to come up in the discussion here on the slide when I talk about other costs. So concerns have been raised that the reduced economic activity of the poor could result in deaths due to hunger and starvation. If you can deliver aid, then that can be avoided. But if not, that's a very tricky situation. So if you ask a poor person, if you give them a choice of taking the chance of getting a COVID-19 infection over the certainty of starvation, they're definitely going to choose the chance of a COVID-19 infection, particularly because they're young, so they know that the probability of even if you get a COVID-19 infection, the probability of dying is very small. But if you're facing a certain starvation, the choice is obvious. However, Indian government has a huge stockpile of food grains. There are several articles in the press about this thing, and so there's no food shortage in the immediate short run. So even if the lockdown lasts for 3 months, I think there's enough food grain in the country that if the government is able to provide aid in a timely manner to people, say through public distribution system, distributes grains, the starvation problem can be completely avoided. Okay, so if the aid to the poor can be delivered in a timely manner, starvation can be avoided. However, if the government fails to deliver and the mitigation efforts cause deaths due to starvation, the gains in lives will be reduced considerably. And so the benefits of lockdown are going to be reduced considerably. And so it's possible that the losses exceed the benefits. Okay, so and more generally, if social distancing policies are not well executed, as evidenced by the government's handling of the migrant worker crisis in India, the number of lives saved and the concomitant economic benefits will be reduced considerably. Okay, so the migrant worker problem is a genuine one, and the informal worker problem, because they are not in the tax net of the government. So in the US, what the government has done is it has sent a check of $1,200 immediately to everyone who makes less than, all families who make less than $150,000. Now everyone here files a tax return, so it's very easy for government to make that transfer. But in the case of India, as we saw on the previous slide, there's a huge fraction of workers are working in the informal economy, and they do not pay any taxes. So government cannot make a transfer to them immediately. There are some other schemes like Jan Dhan Yojana and whatever people can be money can be transferred into those accounts. But if everyone was filing taxes, even if they're not paying taxes, then it would be very easy for government to make a transfer in everyone's account, or at least in the account of poor people. But you do not have such facilities. Maybe government should make it mandatory for everyone to file their returns, even if they are not liable to pay any taxes, because if government has their tax information, then if there's any crisis in the future, direct transfers can be made into those accounts. Okay, another cost is going to come from the loss of remittances. So this is not from a reduction in domestic activities necessarily. Large number of workers work abroad and they send remittances to their families. So World Bank estimates that migrants sent roughly $700 billion in remittances in 2018. And India is the largest recipient of remittances, followed by China and Mexico. And so you guys are probably familiar with all these people from Kerala and other places working in the Gulf countries. So UAE, Saudi Arabia, they attract Qatar, Kuwait, Bahrain, everywhere. They attract huge number of Indians, and many of them don't even go with their families to those places. They live there in dormitories and so on, and they send a lot of money back. So the World Bank estimates a 20% reduction in the remittances. And so this is going to be another negative shock to India. So this is not because of lockdown, but this is going to be an economic cost of COVID-19 for India. And actually for India and many other countries. So remittances work as a sort of de facto social welfare system. That is, these are transfers coming from other countries to the poor in India, Mexico, and so on. And so they take pressure off governments to provide welfare assistance and guarantee a certain standard of living. And a collapse of these remittances could lead in some places to a heightened risk of civil unrest and political instability. I don't think these things are relevant for India. Civil unrest and political instability, I don't think that is likely in the case of India, but in many countries in Africa and so on, this is a distinct possibility. But here, economic activity is going to be slowed down because of lack of remittances as well, because all these people, when they get money, they spend it on buying some domestic goods and services. So there's going to be reduced demand for these goods and services if there are less remittances coming from abroad. Okay, this is another slide on other developing countries. There could be a shortage of food production, and food supply chains could be disrupted. These things could lead to surge in prices. I don't see that happening in India. It's a real problem for a lot of African countries, for countries like Iran and Venezuela, who sell oil and then they buy these things, food and medicine. So for them, there's a big problem because oil prices have tanked as well. So all of you know that oil prices have declined significantly. And in fact, that is good for India because India is a huge importer of oil. And so if India had a lot of storage capacity, this would have been a good time to import a lot of oil and store it because they are dirt cheap. However, I was told that India doesn't have much storage capacity, so that doesn't seem like an option. But still, it gives the government flexibility. If they don't reduce the price of oil at the pump, say the price of gasoline at the pump is not reduced, then the government is collecting a lot of tax revenue from selling gasoline. They're importing these things at the world prices and selling it at a pretty high price. So the difference is tax revenue. That's something that they can use to alleviate the problem coming from COVID, and that money can be used to transfer to the poor people. Okay, so I won't go through all the bullet points here because they're not directly relevant to India. Now let's talk about some other costs of lockdown. So poor children in India and everywhere else suffer the most from school closures because they do not have access to distance learning. So rich kids have access to distance learning, so they can learn through Zoom, or their parents are educated and they are at home, so their parents can teach them as well. But poor kids suffer because of both. They may not have access to equipments to connect to their schools. Their schools may not even be providing distance learning, and their parents may not be educated, so they may not be able to learn from their parents at home as well. So they suffer, and then many of them get nutrition in school. So there could be a disruption in nutrition as well, and lack of adequate nutrition during childhood can have long-lasting effects by impeding brain development. Okay, and finally, there's evidence from developed countries, and I'm sure similar things are happening in India as well, that isolations induced by lockdowns have led to increases in child abuse, domestic abuse, and mental health issues. So these are some other costs of lockdown. Okay, so here is my final slide. I've told you a whole bunch of things that go into the benefits column and the cost column. Now, each country must do its own cost-benefit analysis of the lockdown, whether to have it, how long to have it. If healthcare system is completely dysfunctional, then not many lives can be saved, because I showed you those bell curves, and the way you save lives is because your healthcare system is able to handle sick patients. However, if you don't have a healthcare system, I was listening to a story today that many hospitals in New York City have more ventilators than the entire countries in Africa. And so in that kind of situation, a lockdown may not be able to save many lives. So those countries have to keep that in mind when they're thinking about whether to go for a lockdown or not. Maybe herd immunity route is better for those countries. Okay, so India, I think, has a decent healthcare system. And I was looking at this ranking of Global Health Security Index, and India ranks 57 out of 195 in Global Health Security Index. So I think India has a decent healthcare capacity that it could handle these serious patients if there's not a sudden surge. So lockdown from that point of view may be a viable option in the case of India. And so temporary lockdown with gradual opening up may make sense. And given the myriad benefits and costs of mitigating COVID-19, policymakers face a tough decision on how long the restrictions can be kept in place and how to open the economy. But the bottom line would be that any decision on reopening the economy or extending social distancing should be informed by a comprehensive cost-benefit analysis along the lines I indicated in my presentation. So I'll stop here and I'll take questions.
Thank you, sir. Thank you very much. That was definitely great informative session. But my challenge here today, sir, now is I have close to 35 questions. I'm sure that I won't be able to take all of them for sure, because we have our honorable beloved Vice Chancellor here who will be giving the closing remarks. So I have to keep some time in reserve. But I would request you, sir, the only option I have is to request you to give brief answers so that I can take many, many questions as possible. So may I go ahead, please?
Yeah. Okay. Let me see. I think my
I will pose the questions to you, sir. Don't worry. You don't have to get into the hassle of reading it. I'll pose the questions to you.
Okay, that's fine.
The first question is coming from Shraddha Kokane, and who asks, India has close to none fiscal policy measures. Only monetary policy measures have been announced. What will be the implication the cost of economy will pay for this delay?
Okay, can you repeat the first line? India has, what did you say?
India has close to none fiscal policy measures. Only the monetary policy measures have been announced.
I see. I have seen some fiscal policy measures. So whatever aids you're saying, government is directly giving to people, that should be treated as a fiscal policy. Okay, so whatever transfer is taking place from the government, like Jan Dhan Yojana, and even things like all the meal programs that governments are setting, these are direct transfers from the government to people. And if the government is distributing extra food grains. So these are all things which are direct transfer from the government to the people. So they are fiscal policy. I mean, they're equivalent to fiscal policy. Okay. Now I read the statistics that it's about 0.5 to 1% of GDP. The fiscal stimulus. So that is not large compared to other countries. In the US, initially it was 10%, so expected to go up to 15%. So definitely it's not enough probably, as people are saying. But it also depends on how long the lockdown lasts, and maybe more will be needed. But I think a bigger fiscal stimulus will be required once the economy is out of the lockdown and people are ready to work. There, if you have massive increase in unemployment, then government may have to provide a bigger fiscal stimulus, maybe through MNREGA, creating jobs in rural areas, and big infrastructure projects in urban areas, so that government employs a lot of people, creates a lot of jobs. So government's role may come after the lockdown is over. So yeah.
Thank you, sir. Thank you for that. Sir, if I may request you, if you can please stop sharing so that we'll be able to see on the big screen. That's the only thing. Yeah. So
Okay. So
just click on stop sharing so that we'll be able to see you on big screen.
I'm trying to find out where is.
Just go to the top of the screen. You'll see a big red button which says stop sharing. Yeah, great. Thanks.
Okay.
So next question is coming from Surya, who asks, considering the percentage of people living at the bottom of the pyramid in India, will VSL be relevant to India?
Okay. The value of statistical life, VSL.
Yeah.
Oh, I absolutely. I think that is relevant because you are saving lives, right? So whenever, so I mean, if my answer is no, that would mean that we don't value the lives of people at the bottom, right? So I absolutely think that every life saved is precious and should be valued. Okay, and as I said during the presentation, if you are saving a younger life, you should value it more than an older life. And in fact, a month back, I had written a kind of opinion piece which had come on an online portal, and there I had in fact said that hospitals in Italy are having to make a very tough choice about whom to save, because they have only few ventilators, a lot of patients, so many times they have to decide whether to save a 30-year-old mother of two or a 75-year-old grandfather, and their ethical guidelines are to save a 30-year-old woman than a 75-year-old man, because he has many more because she has many more years of life left. And so I had said that India should also come up with these ethical policies. Otherwise, what will happen in the case of India is that hospitals are definitely going to choose a rich 75-year-old patient versus a poor 30-year-old woman. And so there should be strict ethical guidelines. If there's rationing of care, they should give it prioritize a younger person who has more years of life than an older person. And I would say the similar logic should be used here when thinking about saving lives. Yeah.
Sure. So the next question is coming from Professor Aparna Pathak, who asks, sir, it is obvious that the economy would be affected, but how much time, according to you, should we presume that would be required to get back smoothly the smooth functioning of economy?
Well, that's very difficult to say how much time, but you know, till there is a vaccine, for the virus, or till there's a cure, which is even less likely, it's not going to be normal. So we have to figure out a way to live with it till then. Okay, I don't think lockdown is sustainable in the long run. Maybe you can have it for another 2-3 weeks. So you will have to figure out a way to live with it. So workplaces will be social distance. People will be like 2 meters apart, or whatever distance apart, and you'll have to figure out how to work. Everyone will be wearing masks and taking all the precautions, and you won't have IPL or any of the events which requires a lot of people to gather in one place, but you will have to resume all the essential activities. But I think what the government has to do in terms of policies is to enhance testing capacity, so that they are able to test whoever has the slightest sign of illness, and then immediately trace their contacts and isolate all these people. So testing, tracing, isolating, these have to be an important part of the policy going forward. And that's how we can live with it. That is, we can have a functional economy, and reducing the number of death or spread of the disease. But it's not going to be normal anytime soon, till there's a vaccine or till there's a cure.
True, true. So the next question is coming to us from Professor Dr. Anjali Sane, who asks, Sir, do you advocate free trade policy for recovery, which will fetch more foreign investments, or protectionist policy which would protect domestic producers?
Well, my PhD is in international trade, and I'm a student of Jagdish Bhagwati. So free trade is kind of like a religion for me. Okay, so I'm by nature a believer in free trade. I think trade in general is good. And I don't think India should impose any restrictions. In fact, I see a lot of opportunities for India during this crisis. So for example, I was talking about the vaccines. So if there's a vaccine development, India has tremendous capacity to produce vaccines. Okay, so if a vaccine comes out, you will need 7 billion vaccines for 7 billion people on Earth. And India is one country which has the largest capacity to produce vaccines. Similarly, if some drug comes out, India has tremendous capacity to produce drugs. And recently we saw that there was this talk about hydroxychloroquine being effective, even though it turned out that it's not really effective. And in fact, Modi's initial instinct was to ban the export of this drug to the US, but then Trump convinced him to export. And I thought that turned out to be a brilliant move by Modi, because he agreed to export, and so shipload of this drug was exported to the US. Now it turns out that it's not very effective for treating COVID, but India got valuable foreign exchange, which they can use to buy equipments from China or something like that. So I think shutting down to trade would be a big mistake. Okay, so if you stop exporting things, what if China also says that we will stop exporting, and they have tremendous capacity to produce so many drugs and other things, masks, all kinds of equipment. Okay, so we don't want to play that protective game. It's going to be dangerous, lose-lose situation for everyone. Yeah.
Yeah, thank you, sir. I have close to 6 minutes left and almost 30 questions left. So the next question comes from Dr. Shilpa Dev, who would like to ask, so do you think relaxing lockdown in green zones gradually will escalate costs further?
I think gradual removal of lockdown is a good idea, because it's not sustainable in the long run, right? There's no vaccine. How long you're going to lock the country down? So if some area is deemed safe, it may not be a bad idea to remove lockdown, but with adequate precautions, things that I was talking about earlier. Yeah. So you have to be vigilant. You have to test people and then isolate them and test their contacts. All those things have to be done throughout the country. So you have to have that mechanism in place. But if you think some area is free of COVID, yeah, let them resume their economic activities.
Thank you, sir. So next question is coming from Pooja Mishra, who asks, with discussion happening that there could be a second wave of COVID-19, so would it be a W-shaped recovery?
Well, second wave is quite likely. Yeah, so I don't know what shape is it going to take. Second wave, there could be a third wave. So as long as we don't have a vaccine or a cure, these things could keep coming in waves. And but we have to be prepared for it, and we have to have adequate preparation. And same things again, have enough testing facilities, tracing facilities, and so on. Isolation and quarantine, whatever. So we have to figure out a way to live with it. Yeah.
So the next, a little different question is coming up from Dr. T.J. Vidyasagar, and he asks whether brain drain will increase or decrease.
I don't know, actually. I think from the US point of view, things are going to be different. So the US, in any way has not been encouraging people. Their immigration policies have been pretty restrictive. And so that may have helped India. So a lot of people who would want to migrate are not able to migrate. So maybe brain is staying, or some of it may be coming back as well. So there may be some brain gain going on because people cannot get green cards or H-1B visas here in the US. And so that's between the US and India. But overall, it's not clear to me how these things are going to go. I haven't thought about it. Yeah.
Right, sir, thank you. So the next question is coming from Mr. Jayesh Chandar, who's from Ghaziabad, and he has joined this webinar. Thank you, Mr. Jayesh Chandar. Thank you very much for joining us. So his question is, how about FDI market sentiments and investor risks to their investment?
Could you repeat the last line? Your voice broke. FDI. Yeah.
How about FDI market sentiments and investor risks to their investments?
Well, I mean, FDI is probably going to decrease in the short run because there's a slowdown in economic activity everywhere, and there's huge amount of uncertainty, right? So whenever uncertainty increases, FDI decreases, because whenever you are making any kind of investment, there's a lot of cost, sunk cost, right? So if you don't know whether the demand for your product is going to be high or low, you wait and you don't invest immediately. So FDI is definitely going to suffer. There's going to be a slowdown in FDI or major investments by any company. They're going to wait and see how long it's going to take for the economies of the world to recover before committing resources to things like foreign direct investment. Yeah.
Thank you, sir. So the next question is coming from Swadha Deb Roy and asks, what do you think about the employment market in next year? Will it revive soon?
I hope so, for the sake of all of you who may be looking for a job next year. I hope it's a V-shaped recovery, as Tim Cook was saying. So you go down and then you come back up. So if there's a V-shaped recovery, then it's good news. But it's a guessing game at this stage. I mean, it's very difficult to say. I hope that it is a V-shaped recovery.
Well, thank you, sir. So the next question is coming from a user with username KK Ansel1998. Thank you. I'm sorry, I'm not able to read it properly. The question is, do you consider that there is a connection of international shocks from the side of government? It means in bracket, he says, the idea conveyed in the book of shock doctrine.
I think all the economies are connected. Okay, all the economies are connected in the world. So there is a transmission of shocks from abroad. And I gave you an example of remittances. That's a perfect example of how shocks are transmitted from one country to another, right? So there's a slowdown in Gulf countries as a result of COVID. Say all these Indian workers there are not able to send money back home to Kerala or wherever they are. And now there's a reduction in demand for all the goods and services that they want. And And so there's going to be less production. So people who are producing those goods are going to suffer income losses, and that's how things propagate. Okay, so all the economies are connected, and whenever there's a slowdown in one place, there's going to be lack of demand there. As a result, you cannot sell goods, and so yeah, it propagates to the whole world. Yeah.
Right. Probably the last question, because it's already 11 a.m. I'm sorry for rest all those. I couldn't take the questions. I'm really sorry. So the question comes from a user named Y Bhamre and asks, do you think RBI would have to initiate quantitative easing, and to what would be the cap for it?
Yeah, I'm not a monetary policy expert, but I think RBI is ready to undertake any kind of monetary policy to smooth the transition or coming back to where the economy was. So if there is liquidity constraint, I think RBI will intervene to ease the liquidity constraint. So they're seeing the Fed do so and other central banks do so. So I think RBI is going to use all kinds of monetary policy instruments at its disposal to ease the liquidity problem. And so maybe yes, the answer is yes, I think it would. Yeah.
Thank you, sir. Thank you very much. With this, we have almost reached the end of it. I would request our beloved Honorable Vice Chancellor, Professor Dr. N.T. Rao, if he can please come online live now and say a few words. Over to you, sir.
Thank you, Gautam. Do you hear me?
Yes, I can hear you.
Yes, sir. Loud and clear, sir.
Thank you. Thanks very much, Professor Jha. The fact that one of the comments I was looking at, it was mentioning that in the beginning of your talk, you said, I hope you'll be able to learn something. That's what you said. However, we ended up learning a lot more than something. And every minute was educative is one of the comments. That's one reflection of how good your talk was.
Thank you.
Second measure, I've been into 2 to 3 dozen webinars last 1 month. I've not seen this many inquisitive questions coming to any speaker. So this is the largest number of questions that I've experienced personally. So this is another reflection how inquisitive people were and how good your talk was. Thanks very much for spending your time so late in the evening in California. Thanks very much. Very lucky to have you. Thanks very much for your evening. Thanks very much, Professor.
Thank you. It was a pleasure talking to you all. Thank you very much. Yeah.
Thank you.
Thank you, sir. Thank you very much. Dr. Rajiv Thakur, any last word from your side?
Thank you and grateful, Ranjan. I think first time ever I've heard you talking so much. Probably this transformation is from Ranjan to Professor Ranjan, or I don't know, it is Trump effect. But thank you. A lot of insights. Very difficult to capture them all together. And on behalf of everyone, thank you for agreeing to be here. And we'll have many more interactions in future, hopefully.
Okay. Yeah. Thanks, Rajiv. It was a pleasure to talk to you all. And yeah, bye. Good night from here, and good morning.
Take care.
Yes.
Thank you.
Okay.
Thank you, sir. Thank you. Thank you very much for being here today, sir. Thank you. Thank you very much. My friends, let me quickly give you a reminder that the next series, the next lecture in the your edition of webinar series for knowledge cross-selling would be happening on Wednesday, 29th of April, 4:30 p.m. to 5:30 p.m. And the speaker for that session would be Ms. Jayashree Sundar, who's a former president North of Leo Burnett, formerly. And the topic is going to be personal branding. So I request each one of you to be there and equally be participating with the same energy and enthusiasm for the next session. Thank you. Thank you very much for being here this morning today. Thank you very much. Stay safe, stay healthy, take care of yourself and your loved ones. Thank you. See you again in the next session. Thank you.